presenter is Dr. Michelle Townsend, whose work on self-harm and suicidal behaviours in children, progressing understanding, she'll present now. Thanks.
Thank you, and hi, everybody. That's okay. Firstly, I would like to start by acknowledging the traditional custodians of the lands on which we meet today, and also recognise that the research topic I'm talking about can be quite sensitive for people, and many people have actually been touched by these behaviours personally through lived experience or for caring for others. So the focus of my research for the last 5 years has really been about trying to understand more about why children engage in self-harm and suicidal behaviours to really support, I guess, our identification efforts, to support us to be able to, within the home setting, the school setting and health settings, to be able to respond in effective ways. And to make sure that our research efforts that are a bit limited at the moment in this area, but what we are doing actually gets out there. So people, whether it's teachers, whether it's clinicians, whether it's parents and carers, actually know more about this topic, because at the moment it's pretty limited in that understanding. So when I'm talking about self-harm and suicidal behaviours, they can often be seen on a continuum, but they are quite distinct. So self-harm particularly is about harming yourself in some way, but not necessarily with intent to end your own life. And particularly in children, they use a range of different methods that may be different from, say, an adolescent population or a older adult population. And the other side is with suicidal behaviours, it really has that intention to end one's own life. So we talk about suicidal behaviours as including making plans about suicide, or actually making an attempt on your life, or of course the tragic loss of a life through suicide. Now, with children, it's really challenging to understand how much do they understand about death and how much do they understand about the intentionality of their actions. And the truth is we really don't know. But the research indicates that for children that have been exposed to suicide or that have lost a loved one, they have a greater capacity to understand death and the finality than probably we believe that they may. So we're still doing work in that space, I guess, to really understand the extent that they understand the consequences of their actions. So it's estimated globally that about 7.5% of children aged 12 and under actually have suicidal behaviours, so the thoughts about suicide, and just over 1% engage in self-harm behaviours. So this is a sizable number, and I think a really important public health issue. So the research that I've been working on is really making use of both working with the key stakeholders in the lives of children, so parents and carers, educators, clinicians, as well as child and adolescent and school psychologists, to really understand from their perspectives what's happening, what helps, what doesn't help, what is needed. And I'm also making use of linked data through the linked data sets of health, child protection, education, to really understand more about this issue and the intervention points that we can really assist in. So collaboratively, we're working together with people with lived experience and clinicians to be able to respond to this pressing issue. So our next steps is really trying to understand more about the risk and protective factors for children and how they may differ from adolescents, and particularly looking at providing clinical guidance for this population, and thinking about ways that we can really support educators and parents and carers who can be really struggling when they're faced with this and don't know how to respond. So you see here, I've got the triangle where, we've got the very rare and distressing death of a child by suicide, which it is about 1 every 11 days here in Australia. And I think about this more as a metaphor of the iceberg. So, at the tip of the iceberg, we have, either a death of a child or children that present to emergency department. But below that and hidden to us is submerged behind below the water is a large number of children that are experiencing these behaviours that possibly no one knows about, or very few people. And that's the group we also need to be thinking about. So that's our approach, is thinking about prevention, but also the identification and really evidence-based ways of responding. Thank you.
Thank you, Michelle. And yes, it is such important work, firstly understanding what needs to be done, and then disseminating the best evidence results that you have. So is there a question from the audience for Michelle? Karen.
Thanks, Michelle. Those are really distressing figures you showed us in children under 12. I guess we don't know what happened in the past, but when I was growing up, I never heard of any child having ideas about suicide. So is your research showing that this is a relatively new phenomenon? And if so, what's contributing?
Yes.
Like epidemic, I think you're saying, of self-harm, and then going on to suicidal thoughts.
Yes. So I think these behaviours have always existed to some extent, but the research shows in terms of presentations to health services, when we talk with educators, that it is increasing, what they're seeing, and also the age of onset of these sort of behaviours is decreasing as well. I think that I've got a whole theory and model around why this is increasing, but I think the big thing is the changing nature of childhood. So our children are growing up developmentally digital natives. They have concerns about climate. They have concerns about the war. There's a lot more things that is happening. They've all gone through the pandemic, and this group have been through the pandemic in developmentally really important points. So I think there's some of the factors as well. Then we have the exposure to these behaviours, which is much more available, not necessarily just on the internet and YouTube and platforms like that, but also in song lyrics, things that are commonly accessed by our children. So I think that's part as well.
Well, thank you very much.